So, hi everyone. So, yesterday I had a major case, and after that, while coming to home, I watched one of the YouTube video from Tech School that had inspired me and made me learn one story. And while going through that, I also got one WhatsApp message asking about so and so things and all. Then the lesson I learned from this video, I thought I'll share it with my group. So I asked my group members a small question. So the story goes like this. I'll be sharing you the video later. So during 1975, India had a situation and emergency was declared. So during that situation, there was a lot of restrictions applied. Out of that, even on the restaurant businesses also, restrictions were put up. For example, idli was sold from 25 paise to 10 paise, and the coffee which was sold at 1 rupee was supposed to be sold at 25 paise. So now I put a hypothetical question to my group members. So imagine you own a restaurant, and you own a restaurant, and you are in this situation of emergency. So how are you going to address this emergency situation when such restrictions are put? I'll give the obvious three options. And the first option is close the shop, fire all your employees so that you don't make any losses during that time. Second option is adulterate the food. For example, in the milk, mix more water, risk the quality of food, and also you're risking the health of your customers, but you're going to sustain during this emergency period. And the third option is stick to your morals, maintain the quality, and bear the losses and pay all your workers without firing anyone. So these are the three options. So I gave the same options to my group members and asked them to reply me what they are going to do in this hypothetical situation. I got the answers. Out of that, 30% wanted to prefer the option one, that is the close the restaurant, and 50% of them want to stick to their morals and maintain all the quality and everything. Only 20% gave hypothetical answers like it's going to be difficult, so I have to compromise if this is my only business and all. And there was one good answer saying that how can government put restrictions only on the price of the food? They didn't control the price of the raw materials and all these things. So these were the answers. So I wanted to inspire everyone because I heard this inspirational story from Think School where the presenter presented in a very good way, and the story was about MTR. MTR went through this emergency situation and they survived the business. They chose the option 3, maintain the quality of food. They bear all the losses and still they maintain the quality. They didn't fire any of their employees. So this story was very inspirational. And today they are 1,000 crores worth of company. So similarly, we have other companies also. You can't compare MTR to that of Taj. Both are totally two different restaurants. For example, MTR you get only tiffins, breakfast or South Indian meals, and they operate only during fixed hours. Whereas if you go to Taj restaurant, you get everything whatever you want from breweries, from food, whichever cuisine you want, and they have everything and they run 24 hours. So the pricing of these two things also will be differ. So basically, why are we talking this? Before that, I want to go for one more thing. This emergency situation was running only for 21 months. So let's think hypothetically, what if the emergency is not going to end? Would you still stick to the answer or would you like to switch? Give a pause and think about it. Uh, So why am I talking this? Because in the past few days we've seen a lot of violence against doctors and also abusing the hospitals, saying that they are charging too much money during these crisis situations and all. So I tried to explain most of my colleagues about the group members about the things, but I could never give a justifiable answers because they never looked from my point of view. So let's extrapolate the previous example towards the healthcare system. Now we are in a situation of emergency. Now imagine instead of owning a business like a hotel, you own a hospital and you're going to run it, and now we are in an emergency situation and government has fixed all the rates that your ICU charge has to be this much and everything pricing has been fixed. So what are you going to do, or what is the healthcare sector has to do? Should we close all the hospitals? As the 30% answered, imagine what happens if 30% of the hospitals get closed. And most of the hospitals are still running. Most of the healthcare providers are still doing their jobs. They've actually put extra efforts, working extra hours, and in medical healthcare sector, there are more of salary cuts. There are no salary hikes in spite of working for longer durations. But still, they are fighting. So they are still trying to maintain the quality. Some people try to do some compromise on some other things, but still they are able to provide services for COVID patients. So, as I told earlier, imagine you come to a hotel, everybody has their hunger appetite is different. You can't feed everybody only a single idli and say that, okay, satisfy your hunger, because everybody's appetite is different. Similarly, you can't treat every patient in the same way because every patient is different and every patient needs a different treatment. And you can't expect 100% results because you don't know at what severe condition the patient has presented or how he responded to the treatment. So it's okay now. Now that the second wave is also going to over, we are going to fight over this COVID situation and we are going to come over this. But what next? What if the emergency continues? Are we going to survive? So that's the question which I wanted to pose earlier. So similarly, forget apart from COVID crisis, but once this is over, what about the healthcare system? How are we going to handle it? Most of the government schemes are there, but are they good to provide quality healthcare? Because you are expecting to provide a five-star hotel treatment just by paying 10 rupees. That's not sufficient. You see, healthcare in India is very good and it's at the best price possible. But providing the same healthcare at government scheme price, it's going to be very difficult. Yes, most of the hospitals are doing it, but at what cost? Though the COVID crisis is going to be over, the health situation in our country is going to be always in an emergency situation. So it's time for us to think over, to give a thought on how we are going to survive. The government has to take an action, either improve the healthcare infrastructure, provide more amount from the budget for healthcare sectors. Then only we can improve the healthcare system in our country. Thank you.